stream on a Roku, Fire, Google, or Apple TV? You can watch ABC 11 24/7 with the ABC 11 North Carolina streaming channel.
This morning, Eyewitness News is taking your pressing health questions straight to the experts. Joining us now is family physician Dr. Mieses Malchuk. Dr. Alexa, Senator John Fetterman recently checked himself into the hospital to get treatment for clinical depression. What do you think people can learn from this?
I think the biggest takeaway here is that depression can affect absolutely anyone. In fact, there are 21 million adults here in the United States who are impacted by depression every year. So it's a very common mental health condition. And I think the important thing here to know is that you can always go to the hospital for treatment for depression in very severe cases. And I'm happy that the senator felt comfortable enough to do that. But you can also speak with your primary care physician about your symptoms, and your physician can prescribe medication if that's something that you're interested in or something that you want to talk more about. And then there's also therapy available. So I don't want folks to feel as though they have to suffer in silence. This is very common, and depression is treatable.
Well, switching gears, there's a new study that says more than 1 in 5 kids and adolescents show signs of disordered eating. That's pretty scary. What do parents need to know about that?
I think first we should talk a little bit about what it means to even have disordered eating habits. I think very commonly people think about, formal eating disorders, but it doesn't always have to be that extreme. This really falls on a spectrum. And so disordered eating could include just being overly preoccupied with food or the number of calories that they're consuming. A child may also try to skip meals in an effort to lose weight or in some way change their body shape or body size. And interestingly, disordered eating actually increases the risk of obesity. And that's because by not fueling your body in a way that is healthy, you're also wreaking havoc on your metabolism. And then finally, I have to say it, I have to call it out. Social media is certainly not helping. This is not a new issue. Years ago, we were talking about magazine images and the way in which models were airbrushed. Now, today, we're talking about video filters and photo filters on Instagram. But the problem is the same. It's that media images don't portray accurately the human body. And so I encourage parents to limit their child's use of social media until it's age appropriate. And then once they're using social media, I encourage families to still be involved to help their children interpret what it is that they're seeing.
And last question, there's new data that shows fewer than 6% of doctors in America are Black. Could this affect treatment for patients at all?
The short answer here is yes. There have been multiple studies done that show the benefits of a patient and their physician having things in common, whether that's gender, race, coming from, a similar geographic location. Here in North Carolina, as an example, 20% of our state residents are Black. And so the proportion of physicians here in North Carolina should really mirror that. And right now, unfortunately, it does not. That's a gap that exists. We call that a disparity. And that's a gap that we really need to close. Because again, we know that when there's that match between physicians and their patients, it leads to better patient satisfaction and even better health outcomes. So this is definitely an important issue that we need to be thinking about.
All right, great information. Family physician Dr. Mieses Malchuk, thanks once more. We'll talk to you again.
Thanks for having me.